What if that small painless swelling in your mouth or even a slight difficulty in swallowing isn't as harmless as you think? In the next few minutes, you will uncover the hidden truth behind conditions of the mouth and esophagus, from mucocele and pleomorphic adenoma to squamous cell carcinoma and deadly adenocarcinoma. When they are harmless, when they turn risky, and when the exact signs you should never ignore. So, stay with me. got a bit genetic relation. There is a chance that some mutations might have accumulated in you and they can actually cause Warthin's tumor. But overall, Warthin's tumor is very, very rare. Invasive? No, it is not invasive. Prognosis and survival? Yes, it is very good, because once the salivary gland is removed, there is very less chance, as mentioned earlier, just 2% chance that you are going to redevelop the Warthin's tumor. Comes the big boss of all. This is the mucoepidermoid carcinoma. So carcinoma means simply it is malignant and its treatment is very, very difficult. So as you can see in the photograph, it has spread to a very large area of the face. Okay, so up it has gone towards the brain, and posteriorly also it is, trying to affect the brain, and inferiorly it has extended down to neck. So from inside also you can see it has covered a very big portion of your palate. So let's talk about the features. A very important feature is that this carcinoma is going to be very, very painful, and it is going to present with facial palsy. Facial palsy means there will be paralysis of the muscles of the face. Why is it? Because the tumor is actually compressing your facial nerve, which is causing your facial muscles to get paralyzed. And it is very rapid and has a very aggressive growth. It is going to spread all throughout your one side of the face. So it is not going to remain confined in your salivary gland, to be precise. Okay, so it is fixed. As mentioned earlier, there were tumors which you could actually move with your hand. Those swellings could be moved with your hand, but over here you will see that it is fixed. You can't move it, and it is basically having an invasive growth. It is going to spread everywhere, and sometimes, in some cases, ulcers they may develop, and these ulcers they generally develop on the palates, on palate lesions. And yes, because it is carcinoma, so there will be metastasis. Metastasis means the cancer is going to spread to different parts of the body, and obviously it is going to involve the lymph nodes, and you will see the cervical, the nodes of the neck, basically the lymph nodes of the neck, and other lymph nodes to be swollen. Okay, so very important thing. It can be seen in people of any age group between young to middle age, and genetics. Yes, we have one gene which is the MAML2. So this gene is actually responsible, and if there is a mutation in this gene, so this carcinoma is carried down to the generations. It is rare. It's not that easy to find. Invasive, as told earlier, it is a malignant condition. It is a malignant tumor. So yes, it is very invasive, and it is difficult to treat because it has spread to different parts of the body. There is no way that you can basically localize it, do the surgery, and remove it. And survival says that there is 40 to 50%.
is that alcohol is that alcohol overall does not increase the risk of adenocarcinoma of the esophagus, but yes, it does increase it for the squamous cell carcinoma. So this is not a promotional video that you should consume alcohol. Alcohol overall does harm to the body. So now let's talk about the features. Again, the patient is going to present with dysphagia. Dysphagia means he won't features. Again, the patient is going to present with dysphagia. Dysphagia means he won't be able to swallow things. There will be a weight loss. There will be blood in the vomiters, which is called hematemesis, right? So there will be blood in the vomiters, and the person is going to present with chest pain. It is a deep dull retrosternal pain. There will be a deep dull pain in the back part of the chest. So why does it pain in the back part of the chest? So why does it happen? Again, the same reason that the cancer from the food pipe, it has basically spread to the back. So that is actually causing that pain, and it is a very alarming situation actually. So people they generally present with adenocarcinoma of the esophagus and a very late age of somewhere around 70 years. Genetic predisposition is not much, somewhere around 30%, but yes, it is very invasive because it is a carcinoma. It can spread to different lymph nodes. It can even deposit in your